I also want to talk for a few minutes, Mr. President, about the work of the importance of getting the appropriations bills to the Senate floor. And I want to do that by talking about the opioid epidemic. Our annual opportunity to look at that is both legislative and legislative in terms of deciding how to spend money as we try to deal with this epidemic that claims more lives than any other single accidental cause of death. Car accidents for a long time predominated that list, but in virtually every state and certainly in the country, more people die now from drug overdoses than die from car accidents. There are people of every age, from the high school cheerleader who hurts her leg in Springfield, Missouri, my hometown, who got medicine for that leg injury, and I think it was 3 years later, after 3 years of struggling with addiction, that her mother found her dead in her bedroom of an overdose. Every age, every race, there's stories of incredibly successful people who, from the doctor, the dentist, got more pain medicine than they needed, not because that's what the doctor or dentist intended to do, because doctors in the 1970s, dentists in the 1970s and 80s were told this is non-addictive. There's no reason for people to have pain. They can take these opioid-based painkillers and not have pain. That part was true. The part that wasn't true was the non-addictive part. And the part that wasn't true was what you would do when the doctor was no longer giving you that medicine, or you could no longer act like you were getting the medicine because of pain. You were by then getting it for some other reason. So the appropriations bill that our committees voted out that we're eager to get to the floor includes $3.7 billion of targeted on the opioid epidemic. This is about a 12 times, it's a 1,300% increase over where we were 4 years ago as the Congress became more aware of not only how widespread the epidemic was, but the incredible human cost of the epidemic. The bill includes almost half of that money, $1.5 billion, for state opioid response grants. Now, one reason we're doing this with grants is we really don't know yet all of the options, and we haven't been able to evaluate the best ways to deal with this. We do feel like, in our committee and in the Congress, that it's unlikely that the best way to deal with this in one place is necessarily the best way to deal with it in other places. My state, Missouri, received $10 million last year. We'll receive $28 million this year if this grant funding is approved, and other states will be proportionally, they'll go up exactly as we did. Now, what did we do in Missouri to use that money in our state to see what you could do to deal with this epidemic? 1,700 people have received evidence-based medical treatment for opioid use disorder. 1,700 people in the last 12 months or so have received that. More than 4,300 kits of naloxone, which is what you take when you've overdosed, and that is less effective sometimes than it used to be because of fentanyl, because people don't have any idea. They're trying to help you what you've put into your system, and you don't either. And so occasionally now you'll get that shot to relieve you from the overdose and think that's happened, and then suddenly what you have put in your system overwhelms even that normal cure if you get it on time, or at least that cure might be the wrong word, because all it does is save you that one time. Around 4,000 people have received training on what to do in the event of an overdose. About 10,000 people have received training in our state on topics from treatment to prevention to recovery. For a state like ours, the rate of opioid death has increased. Opioid overdose deaths has more than quadrupled in the past 15 years. That would not be an unusual number for states to see. And West Virginia, Senator Capito and I were here on the floor talking about this earlier this year. This is not necessarily an urban problem. In fact, in most cases, it's more of a rural problem per capita than an urban problem per capita, and we've set aside money targeted for those rural communities. Of the $135 million targeted for rural communities based in different things that appear to be needed more in rural communities than other communities, a couple of $100 million goes into community health centers to support people in their behavioral health concerns and their mental health concerns. If you don't have a mental health problem before you get addicted to opioids, you have one once you've gotten addicted to opioids. And so what happens there in terms of trying to deal with that? Now, Senator Stabenow and I introduced a bill a few years ago, the Excellence in Mental Health Act, and 8 of our states now have situations where they're treating, in that 8-state pilot, where they're treating behavioral health like all other health. That particularly steps up if somebody with an opioid addiction problem has a behavioral health problem they wouldn't have had otherwise. And there's no limit, just like there'd be no limit if you had kidney dialysis. There's also no limit in those 8 states for your behavioral health element. There's no 28 days, and if you haven't whipped this in 28 days, you're going to have to deal with this as a unique problem. Dealing with mental health and behavioral health in the same way matters in all cases, but it particularly seems to apply as people try to beat this addiction. The Department of Labor and Health and Human Services bill includes $60 million for child abuse prevention and treatment programs to support what happens in families when somebody in that family gets into an abuse situation. The number of people that become addicted needs to change, but also how we deal with pain needs to change. And so some unique money available to the National Institute of Health to try to develop a pain medicine that's non-addictive, $500 million into that effort. Mr. President, I just say that in all of these cases, we feel like we've produced a good bill out of our committee. It has about 1/3 of all the money in it after defense is taken off the table, so it's a big bill with large jurisdiction. But, Mr. President, everybody in the Senate deserves a chance to be part of this debate. Everybody in the Senate deserves to look at how the appropriators, with a vote with, I think it was 33-1, voted for this bill. How the appropriators decided to spend the money may be the way everybody decides to spend the money, but everybody ought to have a chance on this floor to say, no, I think this money would be better spent here than here, better spent this way than that way, and for every single senator to be able to be part of that discussion. If we continue this process that we have been in for a few years of one big bill that nobody ever gets to vote on, that means that the senators who aren't on the Appropriations Committee don't have a say in establishing our national priorities. It's an important time to do that. These bills are all out of committee and have been for almost a month now. We have had 3 of them on the floor already. I think we plan to have 4 of them on the floor next week, and maybe Defense and Labor H not too long after that. But these are big issues that every senator should have a say in, and the only way that happens is if these issues are decided right here on the floor. And so, Mr. President, hopefully we'll set some recent records, at least, of having all those bills on the floor and debated, and I would yield the floor.